After an extended absence, we're back. We're going to be working, got several bills in front of us in and around the topic of Maine's medical marijuana program. LD 5, 35, 726, 1258, 752, and 1398. I think first I'd like to take up LD 35 and actually allow qualifying patients to use medical marijuana in a hospital. Senator Haskell.
So, Brakey, can I have an amendment that I asked
Yeah.
Mike to prepare for us, and I wonder if you could distribute that, and I'll be glad to talk about it.
All right.
Thank you very much. And I think the first thing I need to do is thank Mike very much for doing this quickly. It is not in addition, as it says on the top, to what's already existing in 35. It basically does three things. First of all, regarding hospital policy, it requires that the hospital establish a policy regarding the use of forms of prepared marijuana, not smoked or vaporized, for children whose medical condition that produces seizures, not limited to those with the characteristics of epilepsy. Basically, it's going to require the hospital to sit down and establish a policy regarding that. They must do that. It doesn't prescribe what that policy must be, but it says that they must have one. I think that there are hospitals that are doing a variety of things, don't know if they're doing it by policy or not by policy. This would require that. The second part of that would be that they may establish a policy regarding the use of forms of marijuana not smoked or vaporized for patients, admitted patients who have been certified. This gives them the option and says, you may establish a policy, not required to do it. And the second section of it is basically the immunity, which says that if a hospital does that, the officer, board members, hospital are not subject to arrest, agent or employee of the hospital, and you can read that. So that's basically what it does. It's a very first step. It is not as proscriptive as some other thoughts are, but I thought this would be a way to make sure that hospitals engage in the conversation and to show our particular preference that they must engage in the conversation around children.
Thank you, Senator Haskell. And I'll say, as the sponsor of the bill, I very much appreciate bringing this thoughtful amendment to us. I have primarily two concerns, and I've expressed these concerns privately to Senator Haskell, and it should come as no surprise. My first concern is when we're requiring hospitals to establish a policy about. So my initial bill would require that hospitals have to make these accommodations. Last go round, we brought forward some amendments, and we kind of the proposal I ended with was we would limit it to simply seizures. So this would require hospitals to develop a policy. That could be a policy of yes, that could be a policy of no. My concern is with some of these patients and the parents of these patients, where there's currently is this gray area that hospitals are forced to operate under because of the way federal laws currently set up. I guess I'm concerned where there is, in some places, a don't ask, don't tell policy, and individual doctors do sometimes allow this to kind of go on behind the curtain because it's recognizably in the best interest of the patient. My concern is if we are mandating that they have to have a policy on this issue in light of the federal law, I guess I'm concerned that that policy could be in many hospitals across the line no. If you're requiring them to put it down on paper without kind of the state government really encouraging them or requiring them would be to do so. My concern is that it would simply be no, and we might actually be putting some of the patients who at least have been operating and been able to operate somewhat in a gray area on this. My concern is that this piece of it might. My concern is, and I could be wrong, who knows the future, but my concern is it could end up backfiring and end up taking away options from some of these individuals. That being said, so that's the one piece I'm concerned about. I also, my preference would be, I do think in light of the federal laws on this, I do think I would like to see our state government push back a little bit more on this, and I would like to require that hospitals shall not prohibit this for seizure disorders, and to have a stakeholder group to convene to determine if there are additional conditions that might want to also include in that policy. That being said, the rest of those two concerns aside, the rest of this amendment I very much like. I would probably think one way we might proceed as a committee is maybe we have two ought-to-pass reports, and I don't think that's necessarily a bad thing. That gives us two reports that potentially are both ways forward, and we can see in the House and the Senate how the rest of those chambers want to proceed. But it's my thought process. Senator Haskell.
Right, and when I said this isn't necessarily in addition to 35, it may be, we may need to add hospitals into this subsection, to this 24-22 subsection that your bill calls out. I would make sure that we understand that before we went forward, since this is.
Yes, Representative Burstein.
Thank you. Can you explain, I kind of missed what you were saying about a stakeholder group. So you're saying that the hospitals wouldn't need, you don't want the hospitals to have a policy or procedure and then also have to start a stakeholder group to work this issue?
So here's a couple of different things. So aside from the piece on requiring them to establish a policy, but saying their policy can do whatever they want it to be. Aside from that, this amendment does much of what I was seeking to do in some of the amendments. The undrafted amendments I brought forward the last time we met on this. The piece that's really been taken out of this is, and again, this isn't legislative language. This is just me summarizing things. The piece that's I would have a piece in this that would say, hospitals shall not prohibit patients who suffer seizure disorders from self-administering or administering with the aid of a parent or guardian medical marijuana on hospital grounds for the purposes of their condition. And I would also say that a stakeholder group shall convene to determine and recommend if additional conditions should be included in this provision in an approval of the legislature. That's actually something that was suggested by some folks affiliated with the hospitals before kind of the discussion of the Haskell Amendment really kind of came up in the last go around. The thinking on that is one of the conditions we have heard a lot about and being a real problem for individuals in that there are not replacement treatments, replacement medications that work as effectively or even nearly as effectively as these seizure conditions. there are other conditions that probably meet that criteria as well. However, I do think if we are going to be putting a policy mandate on the hospitals, I do think that the bar for that can be pretty high for what we would require that for. I know people often bring up cancer as something. Well, shouldn't cancer be included in this? I don't necessarily object to that. But I don't think that we have, as a committee, heard enough about the ins and outs of that to recommend that at this point, which is why a stakeholder group perhaps convening in the off session to look at if there are individual conditions that we may want to include in this mandated policy might be something we might like to look at in the second session. So that's the thinking. Does that answer your question? Okay. We kind of long. Representative Stuckey.
Thank you, Senator. I'm a little confused because are we suggesting that the hospitals currently don't have policies or haven't been trying to figure out what to do with this? Do they need us to hold their feet to the fire on this, or is this something that they're probably already trying to figure out?
Is that a question for me or for Senator Haskell? Which senator were you addressing?
Exactly. Either or both.
I mean, I would just say that if the federal policy wasn't what the federal policy was, I would never suggest mandating something like this. I just think that we're in a situation where, in light of what federal policy is, it's kind of hard to extract, what decisions originate in hospital policy and what decisions originate in federal policy. I mean, I understand the hospitals wanting to, not be out of compliance with the federal government. The problem is the federal government's way behind on this issue, and thankfully on other areas in the state they haven't.
But I guess my question is, hasn't the hospitals know there's a market-driven interest in the use of marijuana as medicine, and they know where the federal stand is. So, haven't they in boardrooms, the 37 boardrooms or whatever, haven't they had this conversation, and aren't they already doing whatever it is they're going to do?
In terms of setting a policy, Senator.
I think my answer to that question might be that I'm not going to use the word, I'm not going to say like providing cover for them. I'm going to say that we're going to give them an opportunity to have clear directions on legislative intent around the usage of marijuana in hospitals. And we aren't giving them a whole lot of it, but we're giving some of them. The intent. This is the intent that the legislature has set forth. I think that is something that they both can move on, and when asked how come you're doing that, they get to say, because of this. I don't know if that resonates with hospitals or not, but.
Is there any additional discussion, Representative Hymanson?
Yeah, thanks. So I'm looking to stay away from being a legislature that thinks their position. So when we cross the line into treating other diseases like cancer with a legislative group, I have to draw the line there. And being a trustee at a hospital, I'm very aware of the boardroom discussions about policy and what goes on in the hospital, and trying to thread the needle in the right way, knowing all the rules and regulations. And so I'm very supportive of hospital flexibility and their own abilities to make rules for themselves. So I think I can come on board with Senator Haskell's idea of saying to hospitals, you have to make a policy about kids. But I clearly would not ever say what that policy would have to be. And I do understand that once you have it in writing, and you make them do that, that it might all be no. So I'm sort of, liking the flexibility until we get clarity about, I know exactly the position they're in, which is a tough position. And I sort of like the flexibility that they have now to don't ask, don't tell, do it in that manner because it's a mess. So I'm still thinking about whether I can actually support language that says you have to do something, even if it's you have to put a policy together, until 2 years from now or 3 years from now when this will be fixed and it'll be better. So I'm thinking out loud and struggling with this.
Representative Gerstein?
Thank you, Senator. Do you think we could just ask Dan a couple questions or whoever else might be here from the hospital? Who's hiding behind there?
Welcome.
Thank you. Do you want me to just weigh in freestyle here?
No, I was just, well, I guess I'm supposed to say you're supposed to introduce yourself.
Yeah, Jeff Austin at the Maine Hospital Association.
Dan Warren, Maine Health.
I'm just curious, having run surgery centers, everything is a policy and procedure. How do you feel about this? Or is it better to have don't ask, don't tell?
Thank you for the question. This is difficult stuff. I think there are positives and potential negatives if you're a proponent of the bill to what Senator Haskell is proposing. On the one hand, I think what she's saying is it shouldn't be day by day, staff by staff, doctor by doctor. And that's not necessarily fair to patients and families not knowing when they're entering the facility, is this a facility that's going to accommodate our needs? And I think that's what she's seeking, to make it a more conscious decision and a more hospital-wide policy for the benefit of the public. And so that all the clinicians are talking to each other in the same facility. And if they have different views, maybe they can learn from one another. As Senator Brakey has mentioned, there could be a downside to that. I don't know that our guys will adopt a policy of don't ask, don't tell. I don't know that. I think that is the kind of policy that is best left unwritten. I think that is in place in some places today. And if confronted beyond the frontline clinician level and up to executives and lawyers and the rest of it, they may say, we didn't realize that this was happening on those occasions. So you could have a step backward, right? Senator Brakey put that out as a possibility. I guess it is a possibility. Navigating these waters is tricky, and I appreciate what Senator Haskell is proposing. We don't oppose it. It could have, though, a Senator Brakey effect, where he's pulled out.
Please don't name the effect. As Representative King just said, you can't be that bad.
Just one last thing. In response to Representative Stuckey's question, I think the evolutionary status at each hospital is different. There are written down policies that get to the specificity of this issue, and then there are places that are not, and it's just a frontline medical decision as to how a particular patient in a certain circumstance is going to get cared for.
I agree with Jeff, Dan Warren, again with Maine Health. I just add, and I appreciate both committee members working diligently on this. It's really an exercise in trying to find a good compromise. But one of the comments made by Chairman Brakey that kind of had me think for a second was, using this as you'd like to see state government pushing back on the federal government. I just wish that, kind of like in the schoolyard, where in this case the state government's going to be standing behind the hospitals and saying, go get them, and it's our license that's pushing back at the federal government, not the legislature or the state government. So it's like, I'm right behind you, go get them. So that's the one concern I would express about firing a shot across the federal government by using our license. Whether or not they'd be likely to come after it or not. That's the one comment I got.
Representative Stuckey.
So, I appreciate what you said. Some places have dealt with it, some haven't. If I wanted to find out where I should be trying to take my child, would that be a relatively straightforward thing to do, or would...
Right now?
Yeah.
I don't think so. And into it, I defer to the families that live with us. I don't, to speak to you about that. I think there's two ways in which this happens. You're going to an emergency room. You know, you're in an event that's, you don't have time to call in when you're where you are. And then there's sort of transfer situations. You know, you get to one facility and you need to be transferred to another. And it could be helpful in that secondary setting, but I would, you know, defer to the families. I know.
And you probably don't want to have a rule that says it's posted on the wall outside of it.
That it's allowed, you know. I don't know.
Any additional questions for the representatives from the hospitals? Representative Head?
Thank you. Do you know of any hospitals in the state that allow it? Are there any that allow it? If we were to have a child and we needed a place that accepts, is there one that you're aware of?
Let me break that question down a few different ways. I don't know of any states that require its allowance.
No, I mean, right here in
But are there
Maine.
facilities that allow it?
Yeah.
From what I am told from families, in certain circumstances, for certain patients, particularly kids, with untreatable epilepsy, experiencing an event, that there are a range of reactions from hospitals, from some open acceptance to some don't ask, don't tell, draw the curtain, to some that we don't know what that substance is. You're in our facility, we're trying to care for the child. Please don't interfere with care. I think, but I'm much less experienced in this than the family.
Thank you.
Let me, Mr. Austin, if I could ask you, if we, the policy, mandating that they have a policy aside, if we move forward as Senator Haskell's amendment suggests, and when we just, and again, I'm not suggesting that this is how I want to go, I'm just throwing it out there. Just went with immunity for hospitals. If you do have this policy, the state government's not going to get in your way. Meanwhile, you still have the federal government bearing down to go out. Thankfully, I don't think they would, they're not bearing down on medical marijuana so much lately. But hypothetically, their policy still is their policy. Do you think that there's going? Do you think we're going to see positive change if we just if all we do is get the state hurdles out of the way, but the federal hurdles are still there?
Two things. I think one, it focuses the conversation. So that boardroom having that policy conversation doesn't really have to talk about licensing, state licensing. They don't really have to talk about HHS licensing. It focuses the issue to the federal prohibition and what are the bounds of that prohibition, what really is at stake, CMS certification, DEA licenses, and are they really in jeopardy? And you can focus it and you can look to other states' experiences because you're not dealing with different state laws. So it would focus that conversation. And the number of potential objections to adopting the policy would be reduced, wouldn't be altogether erased. And the second thing is, it would send the message to the federal government, if you're into sending those kinds of messages, that you're stepping up first and saying, we're standing down on this issue. And those who want the feds to stand down, to lead by example, might help on that. So we're putting our licensing concerns aside. We think the feds should too. To just tell the feds to do it, but then not to do it with your own certifications and licensing would be a little inconsistent message. So I think that's the two big things. That kind of proposal might be accomplished.
Something on the comment about the federal government and pushing back and whether they would come after hospital licenses now. It's important to note that may be the policy of the current administration, but we're less than 2 years away from a brand new administration. And who knows who's going to be elected to that office? We just switched over to a new Justice Department head. We may have different priorities than Mr. Holder, and we may have a Justice Department in less than 2 years that has a different perspective on medical marijuana and marijuana itself and where it's classified and what's approved.
Well, thankfully, I think President Rand Paul
Well, I mean, my take on that is everything's, and I've said this, everything's fine as long as everything's fine. As soon as something is not fine, everybody goes wrong. So, you know, as long as this has only had a therapeutic effect, as long as this has only had a positive effect, everybody's going to be fine. I mean, that's the way a lot of it will work. It's as soon as something goes sideways with a child, that everything falls apart. But I don't live with this every day. I don't have this as a parent that I have to live with. So.
Additional questions? Well, thank you very much. Senator Haskell.
Thank you. Earlier in the discussion, we talked about whether or not this is additive to 35, and I actually think it is if you read what this does. And Mr. Moore, you asked that question, so I honestly think this is additive to 35. I think we might need the language that's in 35 to get you into the right position in the right number of places. That doesn't.
If I may, the one operative line though in 35 on page 2, section 5, lines 27 to 29, is where you flip it from being a permissive to a...
Okay, and just to get that fixed, but I think you need hospital in here and these other...
Yeah, I asked that at the hearing. I don't know the extent to which we need to be deemed a primary caregiver to the extent we're allowing family self-administer.
I can get some feedback on that about whether that actually needs to be there or not. But this is the content of what I'd like to have happen is
I know, I'd like to invite up very quickly, if she'd like to, Susan Meehan here is one of the moms, and also a constituent of mine. Thank you for coming on here today. Just very quickly, if you have any thoughts you want to share.
Well, this is brand new in front of us today. First, my name is Susan Meehan. I don't know if you want that on the record, but I have had a child in several hospitals in the state and have been treated differently at all of those occurrences in regards to her medical marijuana. Cindy May takes daily medication, and she also uses a marijuana tincture as a rescue medication for her seizures. She's allergic to just about every other rescue medication out there except Valium or diazepam, which must be used very, very cautiously as it frequently causes respiratory arrest. So looking at this quickly, I think that passing flawed legislation is worse than passing no legislation, and a lot of people have put a lot of time into this over this legislative season, including myself, who has a full-time job sitting out in the hallway. But passing flawed legislation is far more dangerous than passing no legislation. Right now, as it stands, I would be more willing as a patient or a parent of a patient to take my chances and go into a hospital as a legal patient in a legal state in need of my medically necessitated medication in a business located in the state of Maine and use it, quite frankly, which I have done with doctors in my face telling me I can't. I think that my risks there are better than letting a hospital write the policy or inviting them to write a policy but not really saying what that policy needs to say. I think that the most important part of this piece of paper is probably what's listed in 4C and at least giving the hospitals immunity from prosecution. Many other states do that for hospitals, nurses, doctors. Connecticut is one example. Please don't take many lessons from Connecticut's medical marijuana program. However, one thing they've done right is provided immunity to nurses, doctors, and hospitals who allow the medication to be administered. I think that's the most important thing we can take out of this entire season of legislation is give the hospitals immunity and let's see where it goes. Right now, I would rather stand on my own. That does put some other parents who aren't quite as strong or insistent that they know their child best and they're going to give her the medication she needs regardless of what you're saying and what degree you hold. I hold a 12-year degree in my child and keeping her alive in a very serious disease. There are some patients who won't be able to stand up to that, and that's still going to be a problem. and it's kind of going to be looked upon as a failure for the season, but I really don't perceive it as that. I see a lot of work has been done and a lot of compromises have been suggested, and I think passing the right legislation is more important than passing something just to succeed in passing something.
Well, thank you very much for your thoughts and your feedback. If the committee were to move forward on something that, of course, my preference would be, and still is, to have requirements, but if the committee were to move forward on something that, with the immunity for hospitals, with saying that the state government is going to allow hospitals to allow this, and hospitals are not going to have anything to fear from state government if they do this. And we didn't mandate that they have to develop a policy if they want to continue having a unwritten don't ask, don't tell policy or what have you. So if we created the immunity and didn't mandate that they have to have a policy, and we also didn't mandate that they have to allow it either, which would be my preference to actually say they have to allow that. But if all we did was create the immunity, do you think that would be a step forward?
Absolutely. I think that would be a big step forward, and it would also give a patient, a patient really, as the hospital has put it, is, and I'm kind of off the record, is they don't really have the right to not let me give the child the medication, even because right now they don't have a policy. And additionally, like I said, you're a legal patient in the state of Maine, in a legal business in the state of Maine. They don't really have the legal right to stop you. I mean, they could make your life miserable, which they have, but they can't stop me. They could call the police, but what are the police going to do? I'm a legal patient in a legal state with a child who's a legal patient with a medication recommended by her doctor. They can't arrest me. I mean, there's no charge. What's the charge?
Are there any questions? Representative Melvin?
I think the amendment pieces.
I would move that we strike all the language that we included in these.
It's been moved and seconded by Representative Malaby and Representative Hymanson. Can we do a quick, and I mean a very quick, corner caucus on them?
Will you finish what the motion was?
So the motion was, Representative Malaby, can you restate your motion?
Thank you. Yes, Mr. Chair, I move we strike the original language and replace it with just that immunity portion. I'm sorry, I don't have it before me.
Okay, let's do a corner caucus.